Hello everyone, this is me Khoula and together with me is Isra. Today I will be presenting on a topic in biomedical instrumentation that is syringe pumps and infusion pumps. So without any further delay, let's take an intro about these devices. So these devices are essential because they precisely deliver fluids such as medications, nutrients or saline solutions directly into the bloodstream or tissues of patients. So the main question that arises is, why is precision so important? And the answer is very simple that even a minor error in fluid delivery, either too fast, too slow, too much, can cause serious patient complications, especially when dealing with potent drugs like chemotherapy agents or insulin. So basically, in hospitals, particularly in critical care, neonatal units and during complex surgeries, manual fluid delivery is not only impractical but dangerous. And thus, understanding these devices is crucial, not just how to use them, but also how they are engineered, how they function internally, and how recent technological advancements are making them safer and smarter. Let's first talk about syringe pumps. So basically a syringe pump is specifically designed for the controlled infusion of very small fluid volumes over a prolonged period of time. They are typically used when high precision is needed, such as administering drugs like dopamine in cardiac patients, giving insulin in diabetics, or delivering anesthetics during surgeries. Unlike infusion pumps that work better for bulk delivery, syringe pumps are best suited for small volumes, slow infusions where the margin of error must be extremely low. We can understand this by an example like in neonatal care, where a premature baby needs only 0.5 milliliters of medication over 1 hour. Only a syringe pump can achieve such control without risk. Now let's break down the main components of syringe pump. It includes syringe barrel, plunger driver, stepper motor, microcontroller, display and keypad, power supply, and battery. So discussing one by one each of them, firstly there is syringe barrel. Syringe barrels are basically hollow cylinders that hold the medication. It must be compatible with the pump and sterile to prevent contamination. On the very second, we have plunger driver. This is a mechanical arm that physically pushes the syringe plunger inward, thereby expelling the fluids at a controlled rate. Stepper motor we have then, very important because it provides precise movements in the small mirrored steps instead of rotating freely. A stepper motor ensures that every tiny movement correlates directly with a small amount of fluid expelled. Now we have microcontroller. Microcontroller is like the brain of the pump. It processes user inputs like desired volumes and flow rates, calculate motor steps needed, monitors sensors, and control alarms. Then we have display and keypad. These are the part of the user interface. Clinicals can input specific parameters like 1 milliliter per hour, 2 milliliter per 2 hours, infusion rate of total volume to be delivered. Clear displays reduce human error. And in very last we have power supply and battery. Since pumps are often used during transport to power failures, batteries provide backup to maintain continuous infusion. Now you all have a question like why we are using stepper motor instead of a DC motor. So the answer is stepper motors are preferred over DC motors because they don't require feedback system for precise positioning, saving space, cost, and complexity.
Working mechanism of a syringe pump. First, the user inputs are entered, which typically include the volume to be infused, its infusion rate, and the total time of infusion through the keypad, and these inputs are displayed for confirmation. Then, the microcontroller processes this data. It calculates exactly how many incremental steps the stepper motor must take to move the plunger at the right distance. This is a very critical part because the amount of fluid expelled depends directly on the distance the plunger moves. Next, the stepper motor activates. It rotates a lead screw, which is a threaded rod that translates rotational motion into linear motion. The plunger driver, attached to the lead screw, pushes the plunger forward, expelling fluid at a slow, controlled, and constant rate. Sensors inside the pump continuously monitor parameters. Occlusion sensor. If the line gets blocked or pressure builds up, infusion stops and an alarm sounds. Plunger position sensor ensures the infusion matches the planned delivery rate. Battery sensor prevents silent shutdown during critical drug delivery. If any error like tubing kink, battery low, syringe empty happens, alarms trigger instantly to alert the healthcare provider. Now, coming to infusion pumps. While syringe pumps specialize in small volumes, infusion pumps handle larger volumes, delivering fluids like IV drips, blood, electrolytes, or even chemotherapy drugs over hours or even days. Infusion pumps are more versatile. They can deliver continuously, like 24-hour hydration drips. They can deliver in boluses, like a sudden push of medication or painkillers. They can also deliver intermittently, like periodic antibiotic doses. In simple terms, infusion pumps are the workhorses of hospital wards, ensuring patients receive precise therapies over long periods without constant supervision. Now, let's break down the components of an infusion pump. Peristaltic mechanism or cassette. It is the most common mechanism in which rollers squeeze a flexible IV tube in a rotating wave motion, pushing the fluid without introducing any air bubbles. Tubing set. It is a special tubing that connects the fluid reservoir to the patient. The tubing must be medical grade, compatible with drugs, and sterile. Pump motor. It drives the rollers or pistons. It is strong enough to overcome resistance in long IV lines to prevent blockage. Control system. This is where users input flow rates, volumes to be infused, and the modes, which can be continuous, bolus, or intermittent, as discussed earlier. Display and alarms. Any real-time feedback on delivery status is shown. Critical alarms include air in line detection, occlusion alarms, empty reservoir warnings, and door open sensors. Most of the time, peristaltic motion is preferred because it ensures non-contaminating and leak-free fluid transfer because the fluid never touches any moving mechanical parts.
Now it's the working mechanisms of infusion pumps. Here's how it operates. First, the nurse or doctor programs the infusion rate, volume, and delivery mode into the control panel. The microcontroller processes these instructions and commands the motor to rotate. In peristaltic pumps, rollers press on the flexible tubing sequentially. This squeezing action moves the fluid forward in pulses but creates a nearly continuous flow, kind of like how our intestine push food forwards, and that is why it is called peristaltic. If it's a volumetric pump, a piston accurately pushes set amounts of fluids in the IV line. Throughout infusion, sensor monitors for flow rate consistency, pressure changes like for blockages or line disconnections, and air bubbles which can cause fetal air embolisms if unnoticed. If a problem is detected, alarms trigger and pump halts immediately to protect the patient. Now let's compare syringe pumps and infusion pumps in a simple but clear way. So firstly, we talk about syringe pumps. Syringe pumps are designed for delivering small and highly precise volumes of fluid. They are mainly used when the dose must be extremely accurate, like in ICU drugs, anesthetics, or pediatric care. They move the plunger of a syringe slowly and steadily, allowing precise delivery even as low as microliters per hour. We can understand it through an example like for a newborn needing a very small amount of antibiotic every hour, a syringe pump would be chosen to avoid any overdose. And now let's talk about infusion pumps. Infusion pumps, in contrast, are made for delivering larger volumes of fluids like saline, blood, or chemotherapy drugs over long periods. They offer more flexibility, delivering continuously in boluses or in cycles depending on the patient's therapy. Their flow rates are higher and better suited for hydration therapies or nutritional support. We can understand this also by an example like during surgery recovery when a patient needs liters of IV fluids for hydration, an infusion pump would be used. An easy and simpler way to remember this is syringe pumps are for microdoses requiring very high accuracy, whereas infusion pumps are for micro volumes focusing on steady and continuous delivery. Both are essential, but each serves a different need based on the patient's treatment plan.
Next, I'll now be discussing recent advancements and improvements in syringe and infusion pumps technology. Smart infusion pumps. Modern infusion pumps are now much smarter, meaning they are linked to hospital software, allowing medication doses to be set electronically. The pump checks the dose against a drug database before starting the infusion, acting like a second pair of eyes to catch human mistakes. For example, if a wrong insulin dose is entered, the pump immediately recognizes it and alerts the staff. Wireless and IoT enabled pumps. Technology has made pumps much more connected. With Wi Fi and Bluetooth, healthcare workers can monitor a patient's infusion remotely. They don't have to be physically present. In ICUs or home settings, this remote access saves time and improves patient care. Artificial intelligence and machine learning. Some infusion systems now use AI to react in real time to a patient's changing condition. Instead of waiting for a nurse to manually adjust settings, the pump can automatically speed up, slow down, or pause medication delivery based on the patient's health signals like blood pressure and temperature. Touchscreen interfaces. The user experience has also been upgraded. Today's pumps come with touchscreens instead of old fashioned buttons and dials or knobs. It's a quicker to set up, easier to train new staff, and there's less chance of entering wrong information. Disposable and sterile components. Hygiene standards have improved too. Many pumps now use disposable tubing and cartridges, parts that are thrown away after one use. This simple change greatly lowers the risk of spreading infections between patients and contamination. Drug error prevention systems. Built in safety checks are now standard. Pumps come loaded with drug libraries and preset safe dosage ranges. If someone tries to give a dangerously high dose, the pump either warns them or stops the infusion completely, which is an important protection, especially with critical medications. Battery improvements. Batteries in modern pumps are lighter, recharge faster, and last longer. This is extremely helpful during patient transport, emergencies, or when there are power interruptions. Integration with electronic health records or EHRs. Another leap forward is full integration with hospital record systems. As the pump delivers medication, it updates the patient's records in real time, meaning no lost data and better decisions by the medical team. Alarm management. Older pumps used to make so much noise that staff became desensitized. New systems focus on cutting down unnecessarily alarms and highlight only critical alerts, making it easier for nurses and doctors to respond to the right issues. Compact and portable designs. Finally, infusion pumps are getting smaller and more mobile. Many are now lightweight and wearable, so patients can receive treatment at home or even while moving around, like during chemotherapy sessions. All these advancements mean fewer medication errors, faster treatment adjustments, safer patient outcomes, and better data integration with electronic health records.
To conclude, syringe and infusion pumps are the backbone of modern hospital care for fluid management. They ensure accuracy, safety, and flexibility, saving lives every day. And with innovation like smart pumps, AI learning, wireless controls, and better user interfaces, these devices are becoming even more powerful and reliable. And thank you very much for your attention.